Well, hello and welcome to all of our Gold viewers from around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome to everyone joining us here today. I'm absolutely delighted to have my friend and colleague here with me today, and it's good to have you back at Gold, Mariana. Thank you for joining us here today.
Hi, thank you. Thank you, Love, for the invitation. I'm very happy to be here again.
Yes, and you are talking in an add-on package right now for our upcoming Gold Neonatal Conference. And of course, I'm very excited about this package, near and dear to my heart. So let's talk a little bit about that just for a moment here. And then we're going to talk about some things that are happening in your world. So I just want to let everybody know that you can go to the Gold Neonatal website right now and register for this event. It is open, and Mariana is going to be speaking as a part of this conference in our neonatal package titled Advancing Human Milk and Breastfeeding Practices in the NICU. So this is going to be a fabulous package, and we're going to get into Mariana's topic in just for a minute. But please, Mariana, welcome back to Gold. As I mentioned, having you back here is always a pleasure for us, but please, would you introduce yourself formally once again to our audience who perhaps have not met you yet, and tell them a little bit about where you are in the world and what your practice looks like?
Yes, thank you. Well, I am a pediatrician and IBCLC since 2011, and I have been working in Mexico City for many, many years now. My main work has been in private practice, but I also support a lot of clinical research and other breastfeeding, for example, the National Health Institute and UNICEF, and I have been involved with the National Association of Lactation Consultants in Mexico City, that's called ACLAM. So I have for many, many years now been working in the lactation field. And I work in a big hospital the private practice with the children. I am a pediatrician, so one of the main things that I see at my office is like neurodevelopment and children diseases and everything. And in the hospital also babies, preterm babies, and babies that are hospitalized because of many other diseases. So that's my main work until now that I'm moving to England.
Oh, well, I mean, I'd have to say that, it must be very sad for your colleagues to be leaving Mexico, but I'm sure that they are welcoming you with open arms to England. And that is very, very exciting. So you'll have to keep us up to date on everything that is happening there for your move. That is just wonderful. Mariana, I wanted to ask you, I know that you are also very involved as part of many different boards yourself. This, you can go ahead, everyone, and read Mariana's bio online, but I know that you've been very supportive of different organizations and boards, including the ACLAM in Mexico. What gives you such drive? I mean, I know you must be very busy. You have a family yourself, as well, but you have been very dedicated to this work. Tell me, how do you keep up with all these things?
Well, I don't know. But my husband says that I live like in an emergency room. That's my way to survive.
Yes.
And
yes.
I think I really have that type of personality.
Yeah.
That I really like to do things. I really like to get involved with things. I'm passionate about breastfeeding, and it's something that happened spontaneously in my life. So
Yeah.
that's something that the life gave to me, and when I got into, it's like very, very difficult to get out. It's
yes.
I'm really passionate about this, and as my son says, I'm gonna have a new adventure. I'm gonna do a fellowship in clinical pediatrics and community, and it's an adventure. But my son is 7 years old, and he told me, "And are you gonna continue working in breastfeeding?" And he was like very amazed. Well, where are we going? Why are we going? No, and what I told him is that doesn't gets off. Like talking about breastfeeding and seeing breastfeeding, it's like that movie, that I see that people is like, I see breastfeeding people everywhere. So it's I know that it's something I will continue doing, and well, I never want to be away of something that I'm interested in. So
Sure,
I like
sure.
working in this.
Yeah, that's wonderful. That's so wonderful. I was thinking when you were describing your situation and how you function, and very high functioning, I can tell. But the passion that you have for doing this, as I personally know, because I've seen your work, I love your work, and of course that's why we wanted you to come back and talk to this topic. But it is true. Once you get into this, there's no going out. I mean, it becomes a drive, I think, for so many of us. This working with families and or working in the field of research, must be very exciting as well. And you've had some opportunity to do that in your line of work, correct?
Yes, yes. I prefer clinical research. Actually, I have always loved like the work with the mothers and supporting the mothers. So that's what
Yeah.
I really do in research, and it has been very nice
Yeah.
experiences.
That's wonderful. That's great. Well, thank you for sharing a little bit about that. Now, I wanted to get into this topic a little bit. I love this topic so much. I feel like this is you speaking my language when you're talking about this topic. So the title of Mariana's presentation, and I know many of you are going to be wanting to listen to this one, is Oral Colostrum Care as an Immunological Intervention in the NICU. And so it says it all there. Everybody loves to know about how colostrum works, how protective it is. Does it work? Does it make a difference? Because it still seems that we are lacking in this area in some cases. I still hear from many folks here at Gold Learning about, where there isn't the support for this. So let's get into it a little bit, because I know that you love this topic too. So first of all, tell me a little bit about the topic itself and why you are so passionate about this particular topic.
Well, it's interesting how when you get into the field of breastfeeding, it's like the you see the mother and you see the baby and you see the breast and you see the latching and you see problems such as, I don't know, difficulty latching or pain or mastitis or things. But as a pediatrician, you get to see the sick babies. You get to see the babies that are not that harmonically things happening, and it's not the skin to skin in the beginning. So I have had a few experiences in treating babies that are hospitalized because of something, or preterm babies, and thinking that this amazing and magical thing about breastfeeding or breast milk is doesn't have a paper there, doesn't have a thing. It's, for me, wasn't like even I couldn't think about it. No, it's like, oh, there must be something that we can do with breast milk. No, it's so amazing. This baby can't miss it. And I have had the opportunity also to support mothers of babies, for example, with Down syndrome or cardiopathy. And once I talked with a doctor that was really resistant with all the breastfeeding situation, and I told him that this is not like the nice thing of breastfeeding. This is the medical part of breastfeeding, and that's, I think, that the situation that made me into the topic a lot, because as medical doctors, we tend to be a lot of technically taught. No,
Sure.
we measure everything and we know, like, very, very technically. And then when you get out a little bit of that box and then you start seeing things a little bit more holistically, like treating a family, that's actually the why I became a pediatrician. I became a pediatrician not because of kids, it was because you treat all the family, and then you get to know all the things that go around that kid, not just the kid, not just the disease. So breastfeeding is part of this. No, breastfeeding is part of the life of a mother. It's so important for me. It's like the most important things that a mother needs support for, because it's not just the breast milk, it's the capacity of that mother to nurture the baby and to feel better as a mother and to feel better as a woman. And there are many, many other things that are a part of these breastfeeding relations that the mother might have with the baby. And when I have had the experience with this baby in particular, that was very emotionally near me, because I had a relation with her because of her other girl, it was amazing how I saw the difference in the way this baby developed, no, and the way that the baby got better and went out, and she continues to come to my office. And it is amazing to see how just this support for this mother, that it seems to be not a lot for many, no, oh, it's just colostrum or just milk or just food. They don't really see all of this. So I think this is the amazing part of this work, and this treatment for these babies is really treating the family, treating the baby, treating the mother, and of course giving the baby the best thing, you know.
My goodness, Mariana, that is treating the whole family. You gave me goosebumps, honestly, when you were speaking, because I think sometimes we do get so caught up in the sort of measurement, or the, you know, just the details that sometimes don't mean the most, you know, about giving milk, and the conversations that we hear about breast is, you know, best, and all these types of things. But really, it's so much bigger. You know, like you said, I love the fact that you treat the whole family. As a pediatrician, hire this woman right away. You are, you know, sometimes I think you're a rare commodity in our field, but I know there are many pediatricians out there that do feel the same way. They love working in this field, and you know, to treat the whole family. But I love that you take you know, breast milk so much beyond the, you know, just the milk and just the latch, you know, as we say, and that is just beautiful. Well, as we wrap up here, you know, Mariana, in your presentation, talking about colostrum with these tiny little fragile babies, what is it that you really want to share with your audience in consideration when they're looking at, you know, some of the details in the NICU? What is your hope for every neonatal unit around the world when they're looking at the aspects of treating infants with colostrum? What are you hoping for?
Well, that every mother and every baby has the opportunity to be together. That maybe it's my desire. And if they're together, they might have much more possibility for the mother to express milk and to give the milk to the baby, and really get into the treatment and go home the earliest that's possible with all of these things.
Yeah, absolutely. Well, thank you so much. How wonderful is that? I think that is, you know, definitely something that we all aspire towards, is hoping that every mother and baby would always be together, and would never have that separation, no matter, you know, the situation. If they are in the NICU, if they are fragile, that they would be together, because we know that when they're together, there is more success. And then we know that they actually go home sooner, which is amazing. And that is very clear in the research as well. So we shall keep that message strong, I think. And for all of our viewers listening in, you take that message back to all of your neonatal units and all the places around the world, so that every parent and baby can be together. Well, thank you so much for being with me here today. It is always my pleasure sitting down with you and listening to all the amazing things that you're doing. And we send you great wishes as you travel across the world into this new position. And we'll look forward to staying up to date with what's happening with you as well. Thank you so much for being with me here today.
Thank you very much, Fiona. It was a pleasure for me also, and for Gold, and for all our viewers. Thank you.
Yeah, absolutely. And don't forget, you can head over right now to goldneonatal.com and register for this entire event, including the add-on package where Mariana will be speaking with advancing human milk and breastfeeding practices in the neonatal unit in the NICU. And of course, the presentation title again, Oral Colostrum Care as an Immunological Intervention in the NICU. Thank you again for joining me here today, and we'll look forward to having you all back very soon. Bye-bye for now, everyone.